Good afternoon. My name is Yvette Cozier, and I have the privilege of serving as the Associate Dean for Diversity, Equity, Inclusion, and Justice at Boston University School of Public Health. On behalf of our school, welcome to this public health conversation. Today's event is part of the 7th installment of our Teaching Public Health series, which began in 2018. This year, we're hosting 3 Teaching Public Health sessions over the course of the summer. Each session will convene contributing authors from the 2nd volume of the book, Teaching Public Health, which is set to be released this fall. First, special thanks to the intellectual architect of these conversations, Lisa Sullivan, our Associate Dean for Education and co-editor of Teaching Public Health, Volumes 1 and 2. And thank you to the Dean's Office and the Marketing and Communications team for making this series possible. Before turning things over to our speakers, I'd like to offer some framing words to help guide us. Public health is at a moment of inflection. Over the past several months, there have been ongoing threats, not only to institutions of higher education, but also to the values of diversity, equity, inclusion, and justice, the very principles that public health is rooted in. It has been a season of challenge, to say the least. Each day, as the ground changes beneath our feet, we ask, how do we proceed? In trying to answer this question, I found it helpful to ask a different question altogether. Do the challenges we currently face present new and uncharted opportunities for us to grow as educators? My hope is that we can use today's space to consider how we can evolve and adapt to help the next generation shape a healthier world. May we not lose sight that we are all lifelong learners with much to reflect on during this period of change. So I think it's very fitting that today's discussion will focus on promoting learning with presentations on supporting learners, transforming assessments to foster learning, and creating spaces of experimentation, equity, and belonging in the public health classroom. I look forward to learning from all of today's speakers. I now have the privilege of introducing today's moderator and co-editor of Teaching Public Health, Volumes 1 and 2, Dr. Sandro Galea. Dean Galea is the Margaret C. Ryan Dean of the School of Public Health, the Eugene S. and Constance Kahn Distinguished Professor in Public Health, and Vice Provost of Interdisciplinary Initiatives at Washington University in St. Louis. He has been named an epidemiology innovator by Time, a top voice in healthcare by LinkedIn, and is one of the most cited social scientists in the world. His writing and work are featured regularly in national and global public media. A native of Malta, he has served as field physician for Doctors Without Borders and has held academic and leadership positions at Boston University, Columbia University, University of Michigan, and the New York Academy of Medicine. It's my pleasure to introduce Dean Galea. Dean Galea, over to you.
Thank you, Dean Cozier. Thank you, everybody, for hosting me here. It's wonderful to be here among the Boston University and the public health community in general. I want to thank Dean Lisa Sullivan, who, as Dean Cozier mentioned, has been the lead on a substantial body of work around teaching public health. It's my privilege now to introduce the speakers for today. I'll start with Christine Arcari. Dr. Arcari is the Senior Associate Dean for Academic Affairs at the Celia Weatherhead School of Public Health and Tropical Medicine at Tulane University. Her leadership responsibilities include school-level strategic planning, academic affairs, faculty development, and cultivation of a diverse and inclusive college community. She is responsible for division development, implementation, and evaluation of all undergraduate and graduate programs and accreditation. Her currently scholarly activities are focused on education. Following Dr. Arcari, we will have Dr. Candice Belanoff. Professor Belanoff is a maternal and child health epidemiologist with a particular interest in the relationship of social forces and inequities to patterns of population health. She's currently investigating associations between measures of structural racism and the occurrence of preterm birth and other adverse perinatal outcomes. Recent research has also addressed health outcomes related to cesarean delivery, substance use among women of reproductive age, and assisted reproductive technology. And finally, we'll hear from Alex Pedowitz. Ms. Pedowitz is a rising fourth-year MD MPH candidate at the University of Miami Miller School of Medicine. She graduated from Vanderbilt University in 2021 with degrees in biochemistry and medicine, health, and society. While at Vanderbilt, she worked as a crisis counselor, which inspired a lasting interest in mental health for young adults. She has continued this interest through her capstone research on youth mental health programming and her advocacy for student wellness. She hopes to combine her interests in mental health, climate resilience, and systems level change, and will be applying to emergency medicine residency programs this fall. Before I turn to the speakers, a reminder for our audience that following individual presentations, we'll turn to a moderated group discussion. When we have about 20 minutes left in the program, I will also draw on audience questions. Please feel free to submit questions using Zoom's Q&A function, which is located in the bottom middle of your screen. Our first speaker is Dr. Arcari. Dr. Arcari, welcome. Over to you. I think you're on mute, Dr. Arcari.
Okay, there we go.
There you go.
Thank you so much for the introduction. I'm Christine Arcari, and I'm pleased to share highlights from the chapter Beyond Grades, Transforming Assessment to Foster Learning, which I co-authored with Annalisa McMillan. Although I'll be presenting today, this work is very much a collaboration, and I want to acknowledge Annalisa's contribution. In this session, I'm going to highlight the key ideas from our chapter, focusing on how well-designed assessment can enhance student learning, improve teaching effectiveness, and support institutional accountability. The field of public health is constantly evolving, and teaching practices also need to evolve. Among all elements of course design, assessment has the greatest potential to transform both how we teach and how students learn. The two main types of assessment are summative and formative. Summative assessment is the traditional approach used to evaluate whether students have mastered course content at the end of a course. Typical summative assessments include midterm and final exams, final papers, and presentations. Formative assessment evaluates student learning throughout the course, giving students the opportunity to process and respond to feedback. Examples of formative assessments include quizzes, homework assignments, classroom discussions, reflections, and think, pair, share activities. Both these assessment types are essential. However, an over-reliance on summative assessments can hinder learning, as they do not provide the opportunity for students to reflect on or demonstrate growth in areas in which they need to improve. Through formative assessments, instructors can interpret student performance and provide feedback that helps learners recognize their strengths, identify areas for improvement, and reflect on how to enhance their work. Assessment should not be viewed solely as a tool for grading, but as a process that promotes learning and continuous growth. Traditional assessment prioritizes summative assessments that are designed to evaluate and document what students have learned, typically at the conclusion of a course. It often emphasizes memorization and one-time high-stakes evaluations. The instructor makes most of the decisions about what to learn, how to learn it, how to demonstrate learning, and when to be assessed. In contrast, learning-centered assessment prioritizes summative and formative assessments and shifts the focus from measuring performance to actively supporting student growth, engagement, and success. Learning-centered assessments provide feedback that helps students reflect, improve, and take ownership of their learning process. It also recognizes diverse learning needs by offering multiple ways for students to demonstrate what they know and can do. Backward design is a course design framework that promotes learning-centered assessment, as it emphasizes the essential role of assessment in course design. It begins with the end in mind. First, the instructor identifies the desired results, the course goals and competencies. What should students know, understand, and be able to do after completing the course? Next, the instructor determines acceptable evidence. What types of assessment will demonstrate that students have attained the desired knowledge and skills? Finally, the instructor plans the learning experiences and instruction. What types of instructional methods and learning content are needed to support learning? Backward design produces full alignment of the course goals, assessments, and learning experiences to maximize student success. Compare backward design to the traditional model for course development. The process begins with the instructor identifying topics they believe are important or interesting, and then writing learning objectives based on that content. Next, the instructor chooses instructional methods such as lectures, readings, and activities to deliver the selected content. Finally, quizzes, exams, or assignments are created after the course is designed to test students' understanding of the content covered. The emphasis is on teaching, meaning what the instructor does. It often results in coverage-based teaching, just trying to get through material, and assessments may not always align well with learning goals. The risk is students may complete tasks without achieving deep learning or intended outcomes. Of course, I'll also mention there is the other traditional model of course development, which is teaching the course the way you were taught it, which is also problematic. It is essential to infuse authentic assessment and authentic learning into the course development process, allowing students to experience the real world by connecting classroom content to real world situations. And this matters because it increases student motivation and engagement, enhances retention and transfer of knowledge, and prepares students for the types of thinking and doing that will be required in their careers. Authentic assessment evaluates students' ability to apply knowledge and skills in meaningful, practical contexts. The focus is on both how students arrive at a solution and the solution itself. Work is evaluated based on standards used outside the classroom and can allow for multiple ways to demonstrate understanding. When assessments mirror real-world problems, students find greater value in what they're learning. Authentic learning emphasizes tasks and problems that mirror those faced by professionals in the field. Students explore multifaceted problems without a single correct answer. Learners work together and reflect on their thinking and process. And learners take ownership of their work and apply critical thinking, creativity, and problem solving. Oops. Designing effective assessments involves creating assessments that accurately measure and actively promote student learning. Equitable assessment design ensures that all students can demonstrate their knowledge and skills, aiming to remove biases and create a balanced evaluation process to help every student succeed. Inclusive assessment design emphasizes creating assessments that actively accommodate diverse groups of students by addressing individual students' needs and characteristics, including backgrounds, learning preferences, future work environments, and targeted skills, knowledge, and abilities. Finally, I'll end with a comment on AI because I kind of have to now when talking about assessment. Generative AI is a powerful tool to support teaching, especially assessment. For example, AI tools can help generate detailed assignment directions, create rubrics for grading students' work, produce basic assessment feedback, and assist in writing cognitive or scenario-based exam questions. However, the growing use of AI by students presents significant challenges for designing fair and meaningful assessments. Best practices include designing assessments that require personal reflection, process documentation, or iterative development. Including a clear syllabus statement on acceptable AI use is a must. Asking students to explain how they used AI tools is also important. Excuse me, and proper handling of students that you suspect used AI inappropriately. In summary, effective assessment is at the core of quality education. Let's use assessment not just to grade, but to grow. Backward design emphasizes the importance of assessment to learning. Authentic learning and assessment engage students in meaningful, real-world tasks that promote deep understanding and the application of knowledge, fostering critical thinking and long-term retention. Equitable and inclusive assessment strategies remove learning barriers, create a balanced, fair, and unbiased assessment process, and produce a learning environment that supports the success of all students. And faculty and students should be encouraged to learn and use emerging technologies like AI thoughtfully and ethically as tools to support learning. Thank you so much.
Thank you, Dr. Arcari. I will now turn to Professor Belanoff. Candice.
Hello, all. Let's see if I'm going to get this right, sharing the right thing.
And Candice, can you raise your volume a bit?
Oh, let's see. I may have to just get closer. Can you hear me okay?
You're a bit faint, so just
That's
maybe,
odd.
I don't know if you're...
Huh. I'm about as close as I can get.
All right,
Can others hear me okay? I'll shout.
Yeah, shout. Go for it.
I know how to do that. Good afternoon. Thank you so much for having me here today. And I'm so pleased and excited to be able to share a little bit of an overview of a chapter I contributed to in the Teaching Public Health book entitled Creating Spaces of Experimentation, Equity, and Belonging in the Public Health Classroom. I'm Candice, she, her, etc. First, I want to acknowledge my fabulous co-authors, one of whom is here with us today, Yvette Cozier, and I'm hoping the other one, Adriana Black, is, well, she's very, very busily studying for her qualifying exam right now, but she's somewhere out there, I think, watching this as well. So thanks all for your wonderful collaboration. So I start with a quote from my teaching hero, Bell Hooks, from her book, Teaching to Transgress, and it goes, any radical pedagogy must insist that everyone's presence is acknowledged. And, you know, the word radical can bring up a lot of big feelings, especially these days. But really what she meant at that time was to critically examine or pull up by the roots, as the Latin root of that word radical would connote, to transform, to make something new. And I really draw inspiration from this quote in my own work. And what we hope to achieve with this book chapter was really three broad things. The first being to offer strategies for creating more equitable relationships, both in and outside of the classroom, hoping that if we modeled an equitable, sort of more even playing field in the classroom, that students might bring that, the ethos of that, out to their work in community doing public health. The second big idea we wanted to share was how we generate ideas for fostering belonging for all in the classroom and going beyond mere inclusion. And I'm grateful to Dr. Arcari for sharing some of her thoughts around grading. That means I could skip a couple of things here because I thought her words about backward design were really wonderful and helpful. And the third thing that we wanted to do was to explore approaches to fostering real growth for all, including ourselves, the instructors, in the classroom. So strategies for more equitable relationships, and back to Bell Hooks's quote, how do we acknowledge everyone's presence in the classroom? Obviously, learning names and pronunciations and respecting folks' gender markers is critical more than ever. And I spend a lot of time trying to figure out pronunciations of names, especially because it's just the most base level of respect. I prefer being on a first name basis with my students. I try to insist on it, although acknowledging that not everybody's comfortable with that. And for some instructors, especially those who have been, come from historically marginalized groups in the academy, that may not be the best option or a comfortable option. Acknowledging all of the expertise and experience already in the room. So students come in and sometimes aren't even aware of how much they've already lived, even if they're only 23 years old. How much expertise and lived experience that they're bringing in and how rich it will make the classroom experience if they fully bring that in. So I really do work to invite the whole self, which means all of the identities of folks walking in the room, knowing that for some folks, again, have historically been asked to check some of those identities at the door. And then again, thanks to Dr. Arcari for talking about some of this, but building in opportunities for the co-creation of space and content and format in the class. One thing I've experimented with recently and is asking smaller groups of students to take responsibility for, say, the first hour of a class session, and they get to determine and set the stage for what are the most important points about this topic, and what are the most important questions that have come up over the course of the week on our discussion board or whatever. And they can move the chairs around, they can decide what activities should be doing, and it really puts on them some of the responsibility for creating the discussion that we're going to have together. The tyranny of grades and rubrics, again, thank you, Dr. Arcari. I really do appreciate the depth of what I just heard from you. So everybody, anybody who's ever taught knows that it's probably our least favorite part of the job is grading, right? And it's not just about, writing comments and blah, blah, blah. It's really about assigning the grade. And why? Because, you go along merrily for the first 3 or 4 weeks of class, getting to know your students and, forging this really lovely relationship. And then wham, the first assignment comes up and everybody's, full of angst and asking you for rubrics and asking you to tell them how to get an A. And really, there is a certain tyranny of having these grades that that stifle creativity, and sort of students just often will panic and just feel like, well, I can't trust myself to know what to do here. I need to go to a rubric and you need to tell me what to do. And so, I know that we have to, for accreditation reasons and other reasons, have to document what people learn in our classrooms, but are there other ways to do this? And some of these have been mentioned, but, intra-group assessments, I know a lot of folks do that, where we ask students to rate each other's contributions to a group project, or allowing for multiple drafts, as was said before, like, creating a conversation over the course of the development of a project, as opposed to like, you did it wrong, you get a whatever, a B, right? Or co-grading, where we actually work with the student to sort of grade something together in collaboration, peer scoring each other, or even community feedback. When we're doing practice-based teaching, we have a community partner. Sometimes getting feedback from the community can be really an effective sort of other dimension of assessment. And then I haven't done this yet, to be honest, but I'm thinking about doing some co-creation of rubrics. Students really want them, but also could we put some of the onus on them to decide what is an A, or what is, exceeding expectations or whatever. Okay, I really love this graphic representation from John A. Powell of the Othering and Belonging Institute at UC Berkeley. Check them out. They have a wonderful website. You should totally check out their resources. But drawing the distinction between these terms, exclusion, inclusion, and belonging. So I definitely favor belonging over inclusion, especially where the classroom is concerned. And here what you see, exclusion obviously is when people aren't literally let into a space. Inclusion, by this definition, says, yes, you're allowed into the space and you're welcome here, but the space is the same, the parameters are set, and you need to sort of conform in some way to fit in. And belonging is where, by virtue of you being here, we are sort of exploding, the shape and the tenor and the, context and on the contents of our space, right? That, and that there's a reciprocity here, right? Like, you not only belong here, and belong to the space, but the space belongs to you. And as such, you're responsible for shaping it and evolving it, just by your presence. So, how do we actually get people thinking about this? We really try to explicitly question in the classroom who has been historically excluded or included, who has historically belonged to the academy, and to whom has the academy belonged historically, and specifically how and why. Like, really getting under the hood of those questions can reveal a lot of what needs to be done to repair the historical damage of the academy. Okay, and fostering real growth for all, that means us too. I really like the messaging of abolition from the perspective of, can we move away from a system of policing and control and punishment toward a system of mutual responsibility and accountability in the classroom? Now, everybody is terrified, professors included, of getting it wrong. And there is a culture of exclusion that comes from saying the wrong thing, doing the wrong thing, as opposed to having a system of repair and growth and having that be the mindset of our classrooms. And so, so in that sense, the first thing that we really need to do is develop these communities of care and mutual responsibility by getting to know each other in a real way. And I often start my semester with a real getting to know you exercise that can feel like, wow, we're taking a long time to find out like whether or not you like to bake, but I really find that it's worth it. And then co-creating classroom norms, will definitely beget more buy-in when norms need to be invoked. If I get us to all collectively decide, what are the rules of of our space together, then when the rubber hits the road, I think people definitely feel more invested in upholding those norms. So, one thing I do is just put people into small groups and say, okay, here's a starter prompt, discuss, come up with some, what you think are some key ideals for our engagement with each other, and then we come together as a fuller group and kind of hone a final document and put it all together. Okay, and I want to credit my friend and colleague Adriana Black for this wonderful mnemonic device of GROW. That is gratitude, reflect, own, welcome. So when the time comes, and it will, when we screw up, when we mess it up, when we get it wrong, what can we do? What can we sort of, you know, hold on to repair and to move ourselves forward? So gratitude meaning express, if somebody comes to you and says, hey, what you did or what you said, you know, really was harmful in some way, right? I won't give a specific example here, we don't have time. But, you know, expressing gratitude for, hey, thank you for sticking your neck out and coming to me, especially if a student is coming to an instructor, that's really hard to do. So expressing gratitude for that person letting you know what happened. And then spending some time reflecting and trying as best we can to not let that reflection be like, well, these kids are just telling me what to do and they can't. No, reflect really on like what happened, getting into that other person's shoes, letting go of some of the defensiveness, and then owning similarly, like, you know, sort of taking ownership of like, yeah, I did that thing and I see how it was harmful and I'm not going to get defensive about it. I'm going to, you know, really work on doing better. And then welcoming feedback in the future. Like, hey, this conversation doesn't end here. I didn't just say, sorry, I'm done. But I welcoming the person to come back and continue that conversation about what happened, right? So grow, people. All right, and I'm going to end with another bell hooks quote, which resides on the door of my office here. The classroom remains the most radical space of possibility in the academy. And I really, truly believe this. There's just so much potential for transformative and liberative work if we can just sort of take that chance and tolerate a little bit of the unknown. So thank you so much.
Thank you, Professor Belanoff, and thank you for mainstreaming the word radical. I'll now move to Alex Pedowitz. Alex.
Hello, everybody. Thank you so much for the chance to be here. Let me go ahead and share my screen. Okay, so hello, everybody. I'm Alex. I'm a fourth-year medical student at the University of Miami, and I'm really excited to talk to you all today about how to support graduate learners and mental health. As a medical student now towards the end of my training, this is a topic that has been very important to me, and I'm excited to have a discussion about how we can promote more sustainable learning, not just for future medical students, but for all graduate students, master's, doctoral, dental, etc. And I just want to give a special thank you to my two co-authors, Dr. Valerie Stark, who is now in her second year of residency at George Washington Division of Internal Medicine, and our faculty mentor, Dr. Shirin Shafazand. So just to get started and frame a little bit of where I'm coming from, first of all, when I mention graduate students, that is an all-encompassing term for medical, doctoral, dental, as mentioned before. It encompasses everybody after the bachelor's degree. But wanted to mention a couple bit of statistics at first, because we have all this discussion on mental health is on the rise. We want to pay attention to wellness, but a lot of these talks focus on undergraduate students, not necessarily students at the graduate level. And the research shows that rates of depression and anxiety among graduates relative to undergraduate or other professional students are 6 times more prevalent in this population. And as the career advances, so as students progress into higher levels of their training approaching their senior year, these rates actually start to worsen. Graduate students compared to the established workforce, for example, face increased cognitive demands. Not only are you learning how to be an adult, learning how to be independent and have a job, but also still facing the demands of being a student, along with other barriers that we'll discuss later in this talk. So when it comes to mental health and wellness, this is a really difficult thing to implement successfully on campus because everybody is coming from all different walks of life, not just backgrounds, but also when you talk about graduate education, not everybody is a 22-year-old straight out of college. Some of them are coming back from 1 year off out of school, and some students are even taking 5, 10, even more years off and coming back. So it's important to understand what kinds of challenges is every group facing so that we can better be prepared to address these. Wanted to start off by talking about first generation students in graduate education face new academic and financial expectations, and there's really limited guidance about how to break into this field for families who have not had parents, grandparents in the field before the graduate students. Now, the double AMC for medical students has compiled a national toolkit for graduate students to be able to see, okay, how can I find a mentor in medicine? What do I need to do at every step along the way to be successful? But for other types of learners, doctoral, dental, to name a few, this type of national toolkit still doesn't exist. And there's a lot of question marks for these students as to how to break into the field. And for students of color, they experience racial microaggressions and systemic discrimination that has been perpetuated throughout the decades. And as a lot of us might be aware of, this has been exacerbated post COVID-19, post the events of 2020, including the Black Lives Matter movement. And these students still face significant barriers and stigma on campus, where compared to non-Indigenous, non-Black, non-people of color, these students have a lower percentage that actually seek out mental health care and support and are actually present at wellness activities, even when they are offered and available on campus. For students coming from LGBTQ or identifying with this population, there is a good proportion of these students who have not disclosed their identity to faculty or peers for various reasons, but a lot of them, according to a survey from National Higher Ed, have changed their behaviors or their appearance in fear of discrimination on campus, even in 2025. And nearly half of these students, even if there are resource centers available on campus, and even if they're tailored to graduate students, a lot of them are unaware and therefore unable to access them. Students coming from international backgrounds often face language barriers, a loss of familiar social customs. Being proficient in English or proficient in whatever language a course is taught in doesn't necessarily translate to comfort with being able to interact with English-speaking members on campus, or even when it comes to journal publications. There's also a lower percentage of these students able to seek success that way. Finally, for students with disabilities, even on a lot of graduate education campuses, there aren't necessarily sufficient appropriate accommodations, or there's a significant concern that those accommodations don't exist on campus. So we actually see a higher percentage of students with disabilities seeking online education or participating less in in-person activities on campus just because of a either existing or perceived lack of accommodation on campus. So that was a lot of talk about what kinds of barriers, what kinds of challenges are in the way, but we're all here to talk about what we can do about it. A good way to start for everybody would be to look at your individual campus environment and culture. Start with a needs assessment. What does the mental health look like on campus? What are priorities from these different groups? What does my school need to do? What is it already doing that can be done better to promote the health and wellness of these students on campus? And general strategies for everybody to consider is this is not an individual challenge. This is not an individual task. This is a campus-wide team-oriented goal towards better mental health support and wellness on campus. So creating that sense of campus urgency and attention to wellness and mental health as a priority, recruiting volunteers across all different backgrounds to reflect the student populations that we're seeking in higher education. Yes, cost elements is important to consider as well. What's actually feasible on my campus? But more importantly, advertising, being transparent with students, and seeking continuous feedback from everyone involved in the process. A couple practical indications as to what that would look like, 3 different levels that we can start to really implement different wellness activities on campus, from an environmental, an organizational, and an individual student level. So offering exercise, for example, to students on campus, where in maybe urban environments where there's not necessarily a gym nearby or a lot of green space to run around, how can that be implemented on the university campus? What kinds of nutritional options are available? On an organizational standpoint, what kind of programs are in place? And do those programs align with student schedules? As a medical student working all odd hours of the night, the week, sometimes I need to have a counseling appointment at 8 p.m. on a Wednesday, which is not necessarily normal business hours, but what meets the unique demands of my students on campus? And then finally, individual level again, what kinds of skills workshops can I offer my students to support in finance, AI literacy, as was mentioned earlier, peer support, the opportunity to be flexible with scheduling to suit the unique needs of an adult learner versus students in undergrad. These are just a couple of examples on what can be implemented to better support graduate student wellness. So just to summarize, we still have yet to really break into what is a catch-all successful framework for how to engage students from all of these different backgrounds. But I hope you're walking away with some tidbits today on where to start, starting with a needs assessment standard. Harvard released a survey a couple of years ago about a potential framework for how to launch a needs-based survey on campus. What are some national guidelines for how to respond to mental health as a glowing crisis on the graduate student perspective? Looking at the American Association of Psychology, the Council for Graduate Education, those are a couple of good resources to be able to look at as to what's a rough draft of a framework I can implement on my campus. And finally, just continuously reevaluating again, how do faculty feel? How do students feel? Is my program effective? How can it change? Putting all of these together can help us better address the different unique needs of different student populations in higher education. So just a slide with my references. And again, thank you all so much for the chance to be here. Really excited to see where we can go going forward.
Wonderful. Thank you. Thank you to all three presenters for excellent presentations. I'm going to start by asking a few questions, and I would encourage, I see there are already some questions from the audience, and I'll turn to audience questions in just a couple of minutes. Let me start by asking for a second about inclusion. And we all realize, and Dean Cozier in her introductory remarks pointed out that these are freighted times to talk about some things, but I certainly have not heard anybody yet make a compelling argument why inclusion is not a desired end, both in the society in which we live as well as in the classrooms in which we teach. So I was wondering if I can ask each of you to talk a little bit about how one addresses inclusion in a time which is fraught in terms of how we are intersecting with notions of inclusion in the larger political and public discourse. Maybe we can just go around in order of the speakers. Maybe Christine, you can go first, then we'll go Candice and Alex.
Sure. I think this should be something that is so fundamental to our classrooms, but is also very difficult. And for me, I think inclusion really starts with allowing everybody to be heard. And I think there's so many students that are in our classrooms that feel that they are not heard or they can't be heard because they are different from other people in their classroom. So, you know, what Candice really started off with talking about how to have this open discussion on day one in your classroom of how to open it up and get people speaking to and listening to each other, I think is really important. But I also think, you know, just talking about my topic of thinking about assessments is to really look at the assessments that we're doing and who are we leaving out of our assessments? Not intentionally, you know, but just because we haven't given it the thought of who may not understand the context of the situation, maybe because they come from a foreign country, they didn't grow up in our culture. So I think we really need to look at our assessments and our learning activities within the classroom, and also to create a safe space for students to be able to take what we're doing and talk about how they can apply it to their own situation and their own experiences. And hopefully that will benefit everybody. I know that I believe strongly that will benefit everybody in the classroom to hear more diverse opinions from our students.
Thank you, Christine. Candice?
Sure. And I agree with everything Christine said. And also, I think, you know, if we look at this conundrum of, inadequate inclusion or belonging, and I won't, get into parsing those definitions necessarily, but one of the problems I think we're facing, and one of the sources of backlash against the academy right now, is the alienation that some folks on the right side of the political spectrum, say, feel towards academia, that they are not included. And we've seen this in, school surveys and whatever, that folks don't feel free to express themselves if they don't hold a political, ideology that's similar to the rest of the class. And I'm not suggesting that we open up our classrooms to sort of unfettered, like, say whatever you want. We can go back to the, whatever decade, that you want to go back to. But I think that there's a way, if we're clever about it, to sort of rethink what we really mean by, again, inclusion versus belonging. Inclusion, for my mind, is something of a you can come in invitation, and belonging is, if you come in, it's going to change what we do here and how we do it. What are we willing to tolerate and what can we hold? So I'm not sure if that's really an answer necessarily, but I think that we do need to address, the alienation that all folks have felt from the academy, which historically is a very exclusive, place and institution. So I don't know. That's a start of an answer. Alex.
No, I agree with what the other speakers were saying. And I think inclusion starts at the low level, starts with informal conversations. I think one of the barriers for learners, especially feeling included in diverse groups, having their opinions represented, is this feeling of inaccessibility to those who are promoting policies and making decisions. So one of the things that's made a huge difference on our campus is just simply presence, faculty being present, lingering for a couple of minutes after lectures, coming out to student events, whether that's a sporting event or an interest groups talk, and just being there in those casual settings. That's where the real conversations happen. And that's where different opinions are the most candid and honest, and things can get done. And that's where, at least from a student perspective, a lot of individuals feel the safest, being able to talk with those in charge.
Let me build on the inclusion just by asking a question from Denise Nelson-Hurwitz, and Candice, you sort of alluded to the sort of the inclusion, belonging, let's say, spectrum. And the question though is particular about how to scale belonging to larger classrooms. I actually think it's an interesting question. And Denise says, I find it difficult to develop strong classroom norms in large lecture halls, and particularly among freshman, sophomore classes, even with suggested prompts. I'm actually wondering if any of the panelists would like to talk a little bit about that in the specific context of larger classes. How does one create belonging and, let's say, cohesion among students? Who would like to jump in?
I haven't taught a huge class before, and if either of my co-presenters has, I will defer to them. I have some thoughts about this, but I also would rather hear from somebody who's taught a big class.
So I've never actually taught a large class, but I've definitely been a part of large lectures. And one of the ways that helps me feel more seen and more heard, even in a face of 300, 400 students, is actually when the lecturer takes the time to split us up into smaller groups of maybe 5 to 6, so I can meet just enough different opinions to have a different experience than mine, but it's a small enough, a manageable enough group where I feel like my voice is heard. And furthermore, if that's a lecture that extends throughout the semester, for example, putting us in groups of 5 to 6 for maybe a couple of weeks at a time, and then switching those smaller groups, I think that's a really good way to start to feel engaged.
Yeah, I have a story on this one that kind of answers the question, and also has really influenced me in the way that I teach. When I was in my doctoral program, I was taking an introduction to epidemiology course. There were over 300 students in this course. And about 2 weeks after the start of the course, I was walking down the hallway and I passed the instructor in the hallway, which of course I didn't even want to make eye contact. And he looked right at me and he said, "Good morning, Christine." And he literally memorized every person's name in that over 300 person class. But for a way and that opened the gateway for me to at least have a relationship with that instructor, but I always remembered that. So I've always gone, and the first thing I do usually takes me a couple of weeks. I memorize everybody's name, but I also break when I have really big courses I'm teaching. And I think the biggest I've probably taught is like 80 to 100 students, is really giving them an opportunity to move into small groups and at least start interacting with each other and then sharing their thoughts out to the larger group.
Thank you. Let me go to a question from Lisa Sullivan, who talks about comments that are excellent suggestions for faculty to create more welcoming classrooms, better support student wellness. But the question specifically is, what might be institutional or structural changes that should or could be made to support faculty in implementing these strategies? So moving it beyond the individual faculty member, what might be institutional structural changes? Maybe let's work backwards. Maybe Alex, why don't you start, and we'll go Alex, Candice, Christine.
I'm sorry, can you repeat the question one more time?
The question is what are institutional or structural changes that could be put in place to support faculty in implementing strategies that support student wellness?
I think giving the faculty the time and flexibility is going to be the biggest thing, because different faculty have different perspectives and opinions on how to interact with students. But at our School of Medicine, for example, we have longitudinal curriculum advisors who are with us for all 4 years of medical school, who have really made a difference in a lot of students' life in navigating the medical education system and in addressing student wellness concerns as well. And time and again, a lot of them mentioned it's really nice to have the built-in time to be an educator, to be an advisor. So I think just first and foremost, granting faculty that time and space to be able to engage with their students on a more personal level would make a huge difference.
Candice.
I totally agree with that. And I know it's tough, especially in these times of, cutbacks in academia, to make, actual space in one's schedule or to allot time and coverage to devote to more student engagement. Because if you are teaching, 100 students, how do you really truly engage with them? How do you even grade 100 papers in a way that's meaningful, that really allows you to share your expertise and make people feel seen? One wonderful thing that we have at the BU School of Public Health is our Office of Graduate Student Life. It's not, it's not faculty, but it is a place where students can really go if they need help in any sort of way regarding wellness. But yeah, I think just carving out time and really valuing teaching, which is our battle cry as teachers, valuing teaching enough to give us the time to really do that, even if we're teaching a giant class. I could never memorize 300 names. That's not in my capacity. That's a part of the trick I will never master. But just, the most meaningful impact I feel like I've had throughout my teaching career has been those, one-on-one or 3-on-1 or whatever interactions with students that have allowed me to really connect with them, really see them, and really learn from them.
Christine?
I would say many faculty, and I'd say all faculty of a certain age, have never been taught how to teach. So I think coming from a kind of an institutional perspective is that we have to put supports in there to teach our faculty how to be successful in the classroom, how to embrace inclusive environments, and how to foster those within their classroom. I think that's really important. We do these, we do a lot of faculty development opportunities. And of course, it's always, I hear it over and over again. The people that don't need it are the people that show up, right? So then I also think that there's the opportunity for the people that do need it. And that's something that maybe needs to be put into their performance evaluation, their annual evaluation with their chair saying, hey, you're struggling in this area, or you could improve in this area. I want you to take X, Y, and Z training. And I think also institutionally, the other thing that we're doing now is that we have changed up our plan of study for all of our PhD programs that now requires all of our doctoral students to take a pedagogy course. So hopefully we can start, training now as their doctoral students, and they'll remember these lessons as they move out into positions and begin teaching themselves.
Christine, since you have the floor, let me pose one very specific question from an anonymous attendee for you. Can you just talk a little bit about the balanced backwards syllabus planning and how you get that approved through relevant committees, and students who want to know what they're going to learn before enrolling in the course, given that you're sort of flipping the by starting with asking students what they want to learn? How do you navigate perhaps some of the bureaucratic but reasonable oversight processes that courses go through?
Yeah, I think it's not, the starting point isn't asking students what they want to learn, but the starting point is thinking about, what are the end goals for this course? We have goals that we put through the course. If you're in a public health, we now have competency-based education. Many of the professions do have competency-based education. So there's competencies that we're mapping into our courses that we expect our students to be able to meet by the time they graduate. So I know, for our own program, we competency map every single course that we have, that this course is supposed to move us forward to these goals. So that's when I say the end in mind, that's what I mean by starting with the end in mind. Like, we have the competencies, the goals, and then there, instead of thinking like, well, how am I going to teach that? The next question becomes, how do we assess that they are meeting these goals?
Wonderful.
And then once we know that we're assessing, then we go to the learning. But I do think, as far as like inclusive teaching, there is an opportunity, and I'll use AI as a great example here. First day of class, discuss with your students, what do you think is acceptable use of AI, right? So give those students ownership in as much as possible in the decisions that they make. I think the other part that they might be going for is this idea of let students choose their assessment. And that's really a design of the assessment where you can have maybe multiple ways that a student can meet it. So maybe a student can, write a policy brief, or maybe they can do a presentation, or maybe they can write an op-ed, right? Like, what you want them to achieve, and think to yourself, are there different things, different ways that they can achieve this? There are different ways that they can demonstrate that.
Thank you. Let me ask you just a broader question now for everybody. And this is from Ann Eldridge Malone. I'll paraphrase a little bit. I appreciate this information, but I'm struggling with how to have this conversation as an authentic conversation informed by the values of public health, given some of the horrors going on in the world around us. How can anything else that we're doing take precedence? I'm intrigued by the panelists' answers to that. Who would like to jump in? Candice, it's an easy question.
I jump in. I mean, I feel that so hard, and I'm such a doom scroller. Like, I'm an inveterate doom scroller, and I am really honest with my students about how distressed I am about what's going on day to day, and I took off the notifications from the New York Times app on my phone, but sometimes my daughter will suddenly text me about something going on. I'm like, no, in the middle of a class. And so what I have said to them is listen, there's still a world that needs us. And we still have to be prepared for it. And we still have to really do our best to not screw it up worse, or to help heal it. Right. And so, we still have to learn what we need to learn. And so we have to take this seriously, and we have to take each other seriously, and not let the ridiculousness and the sort of absurdist, tragicomedy that's unfolding around us all the time, completely occupy our minds. We've got to still exist and do the good work. So, it's just a matter of a practical thing that needs to get done. So we're going to get through this thing on how to find, data on health equity. And if you can't find it because it got taken down off of a website, I'm going to help you figure out where else to find it, because we still need it. We still have to do it. So I don't know. Keep
Alex,
on.
Christine? Alex, go ahead.
I can jump in. I would agree that we definitely do still have a responsibility at the end of the day to finish the education that we came to start. But I also think that there is a place to have these current event discussions, whether it's in lecture or in other events outside of class, for example, and figure out, okay, how can I talk about what's going on in front of the world in front of me while applying it from this lens? So for example, we had an AI in medicine course that just launched in our first year of school, and our first year at Miami. And one of the assignments that we had to do for the course was you had to find a current event going on and relate it back to the world of AI. So we were hearing about all these different news perspectives in real time while thinking about, okay, how can I leverage AI to be a better public health professional? And I think if you're incorporating both current events and giving students the space to express their thoughts and feelings about what's going on in the world around us, because it is inescapable, while also having the responsibility of, okay, how is this going to apply to my line of study? What lens can I use to leverage change and bring everybody together? I think that would be an appropriate way to merge the two.
Christine, you want to add anything to that?
Yeah, and I'll just say never ever assume that every student in your course thinks like you do or believes what you do, because there are going to be students in your course that do not think or believe what you think. And this is where setting the ground rules for being able to have uncomfortable or different discussions and being able to share opposing points of views is really important. And then always return it to the evidence-based. You know, so whether it's what you're saying or what the student's saying, always go back, okay, where is the evidence for that? Where did you learn that? How did you find that? Let's discuss the evidence and what the evidence shows.
Those are helpful answers. Thank you. I'm going to ask one last question from the audience, from someone anonymous. Many public health faculty do not have much of a connection to public health practice. I think it's very true. What recommendations do you have for ensuring that students are being taught and assessed in a manner consistent with the contemporary needs of the potential employer? Let's go around. Christine, why don't you jump in first?
Sure. I mean, that's a balance. I mean, I think we all know the strengths of our faculty, you know, especially being at an R1 institution. We have really hardcore researchers, and then making sure that we bring in practitioners. So depending, you know, who do you have advise or teach certain classes is really based on their skill sets. Do I want to put someone who is really just a really theoretical biostatistician talking about public health practice and putting them in the classroom? No. And vice versa, right? I wouldn't have somebody that's really practice oriented wanting to go and teach the diehard biostats or epi methods. So I think it's using the strengths of your faculty. And also, one thing that is really important to me is trying to promote ways to take real world examples into the classroom. And that's something, whether they're a researcher or a practitioner, can happen. It might need reaching out to the practice community to work with that faculty member to figure out how to make that connection and how to bring in that real world data. But that's possible. It takes time and effort, but it's really rewarding.
Candice?
I saw Yvette and thought like, I'm cut off. Am I cut off, Yvette?
No. Go ahead.
Oh my gosh, and I just lost my focus entirely. I'm going to hand it over to Alex for a second.
Alex, go ahead.
I would agree with what Dr. Arcari said, not being afraid to seek help from other faculty in different disciplines, not being afraid to ask for guest speakers or guest input when designing a lecture, but also designing projects and lectures that can relate back to the real world and get students to think, okay, when you're doing this practice, how can you use your skills to apply it? I think in terms of developing competencies, going back to an earlier comment, going back to the evidence, what do public health practitioners use? What are competencies that need to be attained? And how can I, with my skill set or somebody else that I'm aware of, use their skill set to be able to relay this information to students in a practical manner?
And my train went off the tracks, but it's back on. You know, every opportunity that I have to do practice-based teaching and engage with community partners, I will take. I'm always looking for more. It takes a lot of work. It takes a lot of extra time. Again, if we could build that more into our teaching agenda, I think that is the most valuable thing. The most that my students learn tends to come from community partners. So please, more of that.
I want to say thank you to all the panelists for a really interesting conversation, really interesting presentations, and to the audience who's so engaged. And I'll turn this back over to Dean Cozier.
Well, thank you. I'd like to thank everyone for joining today's discussion. Thank you, Dean Galea, and our speakers, and special thanks to you, our audience. We hope that you'll join us for the next webinar in this series, which will focus on building community and take place on Wednesday, July 30th at 1 p.m. Eastern Time. You can visit publichealthconversations.org to register and learn more about all of our upcoming events. Thank you, take care, and be well.